Good morning. I'm translating a book for Judith Esbeck about cognitive behavioral therapy, and I am going to give you a summary about that. From the books which we translate now, this is the third book about emotion and emotion, how it affects the behavior, and then the behavior it will affect the type of life we live, and even our health, physical health and mental health, psychological health, and spiritual health. So the core beliefs which is produced early in childhood, and most people they believe it is true, and this is due to the reaction between our gene and the environment in which we live, the experience we pass through in the house, with the family, in the street as children, when we play in the school, and in our life experiences. So these are the core beliefs are deeply rooted in the brain and held absolutely true by the person's childhood, and they arise from the interaction between the genes and the environment in which we live. Additionally, there are intermediate beliefs which are revealed as rules, attitude, and assumption. And there is superficial belief which appears spontaneously as automatical thought. And they are very, very common and numerous, and they happen by themselves. They are automatic. So, so the superficial automatic thoughts, they are easy to regulate and modify by using cognitive behavioral therapy with a therapist in sessions of treatment. Or one can read books and learn how to modulate the automatic thoughts, especially if they are negative thoughts. So we can change them into positive thoughts by practicing healthy lifestyle, as well as by practicing the philosophy of gratitude to what we have. Unhealthy lifestyle, which means that we get up in the morning with the sunrise so that we regulate our biological clock, which is 24-hour clock, and it works by the sunshine, by the bright lights, as well as by the darkness in the night, by the way we sleep consistently in the dark, 8 hours every night, 7 hours, 6 to 7 to 8 hours. It depends on the person, and also the type of food we eat, the quality, the quantity, the frequency, the timing, and the water, which should be filtered and clear from toxin, the breathing exercises we do, the gait or the posture, which is very important to give signals to the brain, as well as the tools to relax and to modulate the stress we face every day. Very important thing is the exercises and movement, and this is we keep ourselves healthy, and our powerhouses are the mitochondria are more healthy. So in fact, the book Cognitive Behavioral Therapy, it treats patients with depression, and the people who are in depression, they doesn't mean that they are inherently ill, but rather it is due to the depression. And the depression is a disease collection of triad and symptoms and signs. The symptoms the patient feel: fatigue, feel hopeless, useless, failure, incompetent, nobody like him, he cannot do anything, he is not in control, and so on. All negative thoughts, and these thoughts are repeated in the brain. But in fact, these signs and symptoms, which the people notice, the symptom is noticed by the patient, the sign is noticed by the doctors, because we are trained to observe patient. And so the cause of the illness, in fact, when we give the name depression, we give a name to the signs and symptoms, and we consider it as the disease. Depression is not the disease. The disease in the root cause of the depression. And what is the root cause of the depression? It is inside the cell. What is happening inside the cell, and what is happening exactly in the mitochondria, which are the energy powerhouses. So how they function to produce energy needed by the brain cells to carry out the emotion, the behavior, and the overall body health. So in fact, this is very important to provide the body with what it needs and remove the toxins from what it needs, and the body will deal with the disease and repair itself. The body is a complex biological system which work by energy, and the energy it comes from outside, even the sunlight, which go through the plant to make carbon, and then we eat the food, or we eat the animal which eat the plant or ate the plant, like grass and so on. And then this energy, it will be distributed in our body, it will be used and transformed into many types of energy, like heat, body temperature, like chemical energy, like electricity. Yes, in the brain there is electricity and so on. So the body will find it possess the intelligence, emotional intelligence, cognitive intelligence, and allow itself to heal by itself. Even if we doctors, we don't fully understand what is happening inside the body, but the body knows what is happening inside it and what are the problems inside the cells and the mitochondria. So the diseases in medicine, we classify them by names, but in fact each disease, it's not one name. It is a name given to the signs and symptoms, and each individual patient has different disease, although we call it the same. Why? Because people are unique. They are different in their genes, they are different in their environment, they are different in their reaction to the environment and their perception. So for example, I give example in depression. Not each one with depression is the same. No. Every individual has different causes according to the lifestyle he lived and the gene he received from his mom and dad, and this which received from the previous generation, because most of the thing is a transgenerational. So I hope this is a small introduction about diseases, about energy, and about cognitive behavioral therapy. Thank you and goodbye.